So what I did was I slit the Coban with my scissors. So you can see how the Coban that I wrapped around the palm goes over the fingers. Now you have the open space here where the web space is. So I take any of my scrap material and I place it in between each finger. Scar grows fast. And if you have a burn between your toes or between your fingers, what happens is that scar will actually grow up and cause your hand to web. So the reason why we do this little peanut is essentially to pull that scar and retrain that scar to where we want it to be. So we do that for every finger. Coban wrap of the hand doesn't have to be pretty. But it needs to be functional. So we want to make sure that she can still use her hand so she can continue with her ADLs. That's the other reason why we do the peanuts. Now, sometimes when people are still using their hands, if we don't do another layer here, these will pop off. So see how I still have an open area on the palm? We just take our 3-inch roll. Again, I like 2-inch, but we're going to use 3-inch today. This is what we have. And I decided to just cut my 3-inch down, so, because I'm OCD. Thank you. And we cover any other open area that we might have, and we make sure we get the peanuts so that doesn't come apart. Now, thing about Coban is it's sticky, so a little trick of the trade is if you take lotion, which if you work in a burn unit, you have a lot of lotion, and you put lotion all over the Coban, it will seal the Coban in. Make a fist. And it'll be easier for her to make a fist because now the tape isn't sticking anymore. So that way too, with burn folks, when you start doing the Coban, they're already in the scar development phase, okay? So they're not gonna have really open wounds. If they do, we do a dressing underneath the Coban, like a Tefla cover. So the lotion actually is gonna help because it's gonna soak in, and hydration and moisturization is very, very important in burn. So it's just adding a little extra to their day. Now, to remove the Coban wrap. So because they're gonna have this on for a long period of time, if they are inpatient in the burn unit, we do this twice a day because they have dressing changes twice a day. If they're an outpatient, you can actually have someone wear the Coban for 3 days. You know, depending on if they say their appointment's on a Friday, you can take it off that Monday or Tuesday. The thing about this is most folks aren't a huge fan of Coban. After wearing it for a couple hours, it starts to not feel that good. So what we want to think about is when is the optimal time to use a Coban wrap. It's usually when you have an acute increase in swelling. Coban will take your swelling down very, very quickly. How I always make sure that I'm justifying my treatment intervention is I'll do a figure 8 measurement pre-Coban wrap, and then I'll do a figure 8 measurement post Coban wrap. If there is a significant change, which figure 8 measurement, a significant change is 1.86 centimeters. If there's at least a 1 centimeter change, then my intervention's worked. If I still see a lot of swelling, then I'll continue doing the Coban wrap. Once that swelling's gone, then usually I'll go right back to using some sort of like Jobst or isotoner glove just to help with the scar management piece. So that is basically how to Coban wrap a hand. Now I'm going to show you how to take it off because this is where everybody always gets, they're like, how in the heck do we remove this? So what I do is I will cut from the back of the hand up. And I'll have them slide out. Oop, lost my pinky. Usually the pinky comes too. And then that way, it comes off as a glove. I'm not having to do the Coban wrap. It's a lot easier on the patient to remove the Coban wrap that way. And then you still can see that it's in a good shape, but then you can also see if you have any areas that pull off, things like that, so you can document when you are done treating your patient. So that is how I Coban. Thank you.